is the most wonderful time of the year, and we're celebrating right here on Soda City Living with our 10 Days of Christmas special. For 10 days, we'll be highlighting unique gift ideas, activities, and more that you can do with your family. Check it out.
What is the weight loss program? It is a 12-week program and is individualized. And so you will come to see me one time a week, and I will give you semaglutide or tirzepatide, and I go up on the dose or down on the dose of how you are feeling, if you're still hungry, and making sure you're not having the side effects like some constipation or some nausea. That's why it's very individualized and very controlled to see me. And we talk about your food. I have a food log we go over, and I try to help them learn how to exercise and eat correctly. So the semaglutide is a GLP-1, and in our gut we have a protein called a GLP-1, and when we're really hungry, where our blood sugar is usually going up and down, and so this medication helps normalize our blood sugar. And when you're eating, you get full faster, and you just push the plate away. So it teaches you to be like, okay, I've had enough, because it helps with our blood sugar normalized. We start out at 12 weeks, 3 months, but actually it's longer. We usually go longer, maybe a year. They'll come in after the 3 months. We'll do like a maintenance program, and that's very individualized as well. And they'll see me once a month or every 2 weeks. We'll keep that going for a year, some people longer, just to help. And it's okay to do that. You can be on both of these medications for the rest of your life. One of the huge benefits of them coming here is accountability. So they weigh in, I do their body fat percentage. We go over every week they're supposed to show me their food chart, and I look at their foods and say, okay, we need to cut back on this or add this, because I have a food sheet. And it's very beneficial and individualized for them to come in and see me once a week, because some of my patients that have actually missed weeks, they've fallen off the train, and they really enjoy coming to see me because it helps them stay on track. They can get in touch with me actually through email or my cell phone. I have a lot of patients that will text me, and I call to check on them to make sure they're doing okay. And it's great. They really do like that accountability, because they can't lie to me when they come in every week. So when they come in for a consultation, I assess I listen to their heart, lungs. We go over all their medications, their health history, their family history, and then the very next thing I do is I draw some lab work. And actually, before I even start the medication or anything, they have to have the lab work done. I send them to a lab, and I'll get the results back in 24 hours. And then they'll come back and see me the next week. I test their thyroid, their hormone levels, their cholesterol, their electrolytes, to make sure they're a good fit for the medication, and they don't need to be started on a thyroid medication or start hormone therapy. And I go from there. That's how the consultation starts. It's amazing, actually. So the medications, they have been proven to decrease heart death 33% and heart failure 18%, and also diabetes. They decrease all of that, and they help decrease so they don't have heart attacks or get chronic kidney disease. So I really focus on that, and they actually can come off some of their blood pressure medications and some of their cholesterol medications after they lose the weight, if it's appropriate. When I'm looking at their medication list, if they're taking another diabetic medication, sometimes I will maybe cut that in half to get them on this medication, because it will improve their insulin levels and their A1C levels. So yes, I will look at that, but that's really the only medication that I would have their diabetes medications issues will kind of tune up and tune around, change maybe. We use we have access to Epic or the electronic medical record. We do a great job here. If you forget your medications, or you forget, your health history or surgeries, our staff does a wonderful job by getting on, and I have great access to get your records. It's very easy if you forget those things, but that's a huge thing. we're treating the patient as a whole, which I love and I think is great. It's just like a one-stop place. You get your wellness, weight loss, you get the general practice, the chiropractic care, and the physical therapy and massage therapy. It's just a great place to come and be treated.
We'll be right back with more of our 10 Days of Christmas special.